joined in early, so we have few cases to discuss. Before that, some questions left. I'll answer those questions first. Yeah, welcome, Dr. Navjot. Yeah, Dr. Palak. So there was one question in relation to mind symptoms that somebody wanted to know something about anacardium mind. Whenever we think about anacardium, two or three things which are basically taught in our colleges knowledge, that very angry and very malicious personality and all that is there. But there are some things, yeah, hello Dr. Sharon, but there are some things that I think everybody should remember in anacardium. See, basically if you want to see a remedy, you have to first see how does that remedy starts. In anacardium, one thing is very very important. Hello Dr. Avni. Anacardium, one thing is very very important. An anacardium patient has a lot of things to achieve. He wants to achieve lot of things, lot of desires to achieve. And when you're having so much desire, to do something in life, if you get it, you want more. If you get it, you want more. But if you don't get it, you again strive to get it more. And because of that, all the symptoms starts, like anger starts, the violency starts, the abruptness starts, the imperfectness, the rudeness, the humiliation, the mortification, the contradiction, everything starts. So that is basically the entry point of anacardium. That is, he desires to achieve things in life. Very, very close to anacardium, if you want to see achieve things in life. Which is the remedy that comes to your mind with anacardium? Hello, Dr. Babel, Dr. Vanj, Dr. Malakar, Dr. Palak. So if you want to achieve things in life, everything starts because of that in anacardium. Don't remember that the elements of contradiction and contrary and has two trains of thoughts and violence. That is there. But you must know how and why does it start. So whenever somebody tells you about, yeah, Naksomika. So such an important remedy, no, it is Naksomika. So whenever you want to achieve something in life and you have striving so hard, think about anacardium, think about Naksomika, think about Coffea. So we'll talk something of, I hope you understood something, the entry point of anacardium, everybody. If you basically understand, then I can go further basically and make you understand the anacardium mind. It's not always going home and reading the Mathematica and just mugging it up. You'll forget one day. So this is how the anacardium starts. And then, if everything goes well, it's good. If everything does not go well, then you have the anacardium personality, elements from slightest offense. Welcome, Sultan. Elements from, anger from slightest offense. That's anacardium, Itna zada. And when anacardium wants to achieve in life and he does not achieve, or it's very late, he will find bad in everything. It is written, anger is so violent, takes bad of everything, takes bad part in everything. मतलब आप anacardium को, if you tell anacardium something good also, he will find out something bad in that. That's how an anacardium personality develops in life. I hope you're understanding the Mathematica part. Anybody, everybody, I hope you're understanding. So anacardium, that's how. Then if you talk rudely, then you talk rudely to anacardium, he is not happy. If you tell something no against his will, he is not happy. If you tell something to do, he will not do it because he thinks that something else is right. And the whole Mathematica, the drug picture of anacardium mind starts. I hope, and the anger is so violent, becomes so violent that what happens, the anger violence is so increased that it is written that anger as if he could have stabbed anybody, stabbing, like Naksomika, like Hipparchus, like Mercury. But see how Naksomika and anacardium are so close. I hope everybody understands that. I hope you're getting that gist of anacardium. Everybody. Good afternoon, Dr. Madan. Welcome, Dr. Methali Fatima. Yeah, welcome. I hope you're getting anacardium. So next time if somebody asks you, of course the anger part is there, but the starting point wants to achieve everything in life, wants to achieve too much in life, and that's how the anacardium starts. This what I am told you, anger, if it is not going according to his will, and if he's striving to achieve something, then a lot of anxiety is also there in anacardium. Okay. So, and that is anxiety, anxiety in the chest, anxiety standing aggravation, anxiety trifles about anxiety, lot of anxieties. So this is how you have to relate anacardium in your practice. And then of course there are other symptoms of anacardium which are very very important that you can look in your materia medica and get to. But just I wanted to tell something of anacardium because a lot of questions were there about the anacardium mind and the anger of anacardium. But a very important symptom of anacardium is mind. Whenever the patient is anxious, बहुत चिंताएं रहती है, बहुत चिंताएं रहती, and he starts to eat, the anxiety is better. And that's a very very important symptom of again anacardium. And one more drug that I think everybody remembers is iodine. So this is how Mathematics is developed, and this is how, of course, I can go deeper and deeper and give you some more symptoms on how anacardium basically comes. But these basically are the entry points, and these are the anxiety and the anger of anacardium that you all should remember, because everything has a cause. You are not born angry, so everything has a cause, and if that cause basically is found out, and then it starts basically to create the whole blown anacardium in our materia medica. So I hope that's okay, and let us go further. Yes, you can have a lot of other permutation combinations of anacardium and lot of symptoms. This is how an anacardium patient develops in life. Okay, so this was one thing which I wanted to share with you. If do we have any questions on the YouTube or whenever, if it's there, please write. One more symptom, one more question which was frequently asked in my, whenever I put cases on my what you call materia medica group. I think put about 72 to 73 cases I have put. I don't know my assistants how many cases they have put, but that whatever I have put in my materia medica, in my materia medica group, those are OPD diaries that everyday practice when we get some symptoms and get relief. And you must have noticed that in my every case, the interpretation of symptom is the key. You can know the whole materia medica, the whole repertory and the whole organon, but the interpretation of symptoms are very, very important. If you see that interpretation, you'll be able to prescribe better. Now there was one more, a case where the patient, my assistant doctors took the case and said, sir, the patient is very, very loquacious. There was a lot of loquacity in the patient, and immediately, my assistant told her she appears like a cyst. Now you have to differentiate loquacity. She was talking absolutely stupid. Stupid means like I was asking her something, she was telling us something, and she was telling us something in detail. Now this is called as garrulous loquacity. It's a very, very important remedy. It is called as a garrulous loquacity. And do you understand the meaning of garrulous loquacity? Do you understand garrulous loquacity? A very, very important remedy, garrulous loquacity, Garr. And we prescribe that, and I am expecting a fantastic result, with that remedy. Now you have to understand what is the meaning of garrulous loquacity. Anybody? And the remedy. The remedy is also important. That's how you basically evolve and learn your materia medica. Can we have something, or I'll this case we had a fantastic case. It was a case of hypercholesteremia with high TG level. We have the reports also. The TG was, I think, 437 and cholesterol was 212. After the remedy, in few, I think, months time, the TG came to 95 and cholesterol came to 154. Good evening, SM. Now, we took the prescription garrulous loquacity. Garrulous loquacity means stupid talking. That is not lachesis. And then we prescribed the patient Paris quadrifolia. Unimportant. That we prescribed the patient Paris quadrifolia. In Paris quadrifolia, garrulous loquacity is very, very important. See, that's what I'm telling Dr. Navjot and everybody. Normally, when you open your Facebook, you open your WhatsApp group, you open some social media, every day one rubric is there. The explanation of the rubric which is written in the repertory, in the dictionary, and it is written there. But actually, when the patient is in front of you, that is important. How do you interpret that symptom? You can know all the interpretations from the the dictionary, but on the patient it is so much important. And when we put garrulous loquacity, the only child in the family is Paris quadrifolia, and nobody talks to him for long, and the silly behavior of the child is basically to attract attention. That is parasquadrifolia. And my assistant doctor, she made a wonderful case of she had taken a wonderful case, and parasquadrifolia basically gave us very good results. The reports are normal now. So I just wanted to tell that homeopathy is all about interpretation. That is very important. So I'll just take one question. Doctor, as you were talking about anger, lady of 40 years, violent anger on very small things or matters happens with hand gestures, with abusive words, accusing others. Yeah, see, basically what I wanted to tell about anacardium was that everybody knows anger. Everybody knows it has very violent anger, but how does it start? You know, it has to have some cause, no? So we were basically talking about anacardium because this patient wants to achieve lot of things in life. That's why an anacardium anger starts. For violent anger, we have lots of remedies. We have anacardium, we have nux vomica, we have nitric acid, we have chamomilla, we have tarantula, we have staphylococcus, but we do have anacardium, and that's why I just wanted to differentiate anacardium. I hope you understood anacardium, because see, a lot of medical you must have been learned, but these are very, very important to differentiate. For example, if you take nitric acid basically also has the same symptom of anger, which is very violent, but the cause of anger of nitric acid is something very different. In nitric acid, you remember that elements from that of a very close friend first, or the patient basically has anger from caressing, and then the whole drug picture of nitric acid starts. See, I've been teaching now Mater Medica for the past, I think, 6 months to one of the group of college groups, and that's why when I teach Mater Medica, a lot of people are telling me, how do you remember symptoms? We remember symptom basically by knowing how does it start. When you know the starting point of a drug, how does a drug evolve, automatically everything falls into place. That's why. Okay, Dr. Anushka will join the Mater Medica group. Dr. Madan. So that's why. So if you have this case, Dr. Madan, that the ladies there takes, you can think about these 3-4 remedies, and then you can of course tell me some more symptoms so that we will be able to judge the anger violent. These are the remedies basically which you must take into account. A lady who was very famous, but now there is new person who has taken her position. Can you share your idea of interpretation? Yeah, this is very so common, Dr. Raha. It's not only in the glamour field, in a doctor's field also, we have this problem that somebody is a very good speaker and a young doctor comes and that place is in basically, then the senior doctor feels, okay, now my place is basically dicey, now what to do? And then all the train of thought starts in that, and the train of thoughts basically would start basically from what, anybody? The train of thought starts basically because of only one symptom, and that is jealousy. You start getting jealous because he is now taking in your place. That means the person who was there at the top spot, he is basically either a selfish personality or a personality who is very jealous. He cannot bear anybody coming or replacing him. So we have combination of rubrics like jealousy and the selfishness. Two things. And of course, the remedy would be very, very clear when we have a lot of symptoms. Okay, Navjot wants some symptoms of parasquadrifolia. I'll just finish off this case then. She remembers even young, if the love was shown more in her opinion to others, the world becomes different. And mother auntie, she was always afraid of being hurt, so would limit her love to that. Yeah, so basically, we need a person who is very sensitive, who basically now, if you see, if you see rubrics and you attach those rubrics, there are 3-4 things which are very, very important. Everything starts now. Jealousy, selfishness starts because of one thing. Remember that in your life, it starts because of insecurity. It starts because of insecurity, and every insecurity is not calcarea carb or calcareas. Insecurity gradually then gives rise to a lot of permutation combinations, and then basically we have full-blown pictures of remedy. We can think about remedies like calcarea, we can think of remedies like pulsatilla, like medorinum, like sepia. Then it comes ignitia, lachesis, nux vomica, platina, kalicarb. These remedies comes. when the patient because of that becomes very what you call narrow-minded, and then everything starts in those cases. So these are the permutation combination that you have to think about. Like I said, Nux vomica, Platina, Calcarea, Lyco, Metroneum, Sulfur, and then you can add few of the other symptoms of the patient's innate character and now how he is reacting to the environment, and gradually you get the symptom. If he is lovesick, then there are other remedies basically only related to love. So everything starts from insecurity. Okay, then you have love for family or love sick or love for opposite sexes, love for nature, love perversity, love for power. Lot of things come into that, but the whole basic gist starts from the insecurity. Then the patient becomes selfish, then he becomes jealous, and then he becomes narrow-minded. In syphilitic, that patient can become very rigid, and the patient becomes very obsessive, and OCD develops. This is how the journey of miasm is there, from SORA to psychosis to syphilis. Okay, so I hope you got some of the answers to your questions, and you can always refer to some Metermedica, and then you will be able to get it. Now, Paris quadrifolia, she's avoiding others, and yeah, she's sensitive to hurt. You can then again put some see, if the patient is sensitive to hurt, then again means the patient basically is withdrawing. So withdrawing means, then what you call, the patient is sensitive to external impression, the patient is sensitive to emotion, the patient is sensitive to mental impression, the patient is sensitive to XYZ. Then there are a lot of sensitiveness. But in my case, basically, I would take the patient is sensitive. And if your basically approach towards the metamorphosis of rubric is there, you can always think about sensitiveness to pain. It could be mental pain also and physical pain also. So we have a rubric in the mind, sensitiveness to pain. You can add that rubric in your, and when the patient is sensitive to pain, you have remedies like Nux vomica, nitric acid, and lots of the other remedies, and you can always basically prescribe with this. Yeah, I hope you got it. So I'll just finish off first the Paris quadrifolia, because Paris quadrifolia is very fresh in my mind. Paris quadrifolia patient is worse from thinking. Is worse from thinking. That's a very important symptom of Paris quadrifolia. Worse from thinking. Okay. I hope you are getting it in my YouTube live. There's no. So worse from thinking, and the patient is very much sensitive to odors, sensitive to bread, milk, fish, lot of other things. Disordered sense of touch. That is a very important symptom of Paris quadrifolia. Disordered sense of touch. Everything feels rough to touch. Write down in your Metermedica. Write down in your Metermedica. Everything feels rough to touch. A very important symptom of Paris quadrifolia. I hope, Dr. Navjot, you are writing down. Everything seems rough to touch. And one more symptom, there is a feeling of pressure in the region of throat. That is Paris quadrifolia, whatever symptoms I can get. Yeah. So one question, sir, what we can think of pigmentation of face except Kaliars? See, again, this whenever we have cases, whenever we have cases and there is pigmentation, if you ask me also, treating melasma or this all are such a what you call headache to treat, because the progress I have seen is very slow in most of the cases, and it is sometimes difficult also. Whenever there is discoloration, pigmentation of the face, it is very important to understand in order to first differentiate which type of discoloration is there. We have lot of discoloration like ashy, whatever I have seen. Okay, I'll just see I'll say what I have seen. Ashy discoloration, blackish discoloration. Sometimes there is a bluish tinge in discoloration, and those are and sometimes there's a reddish hue, reddish type of discoloration. Sometimes the discolorations are in spots. Okay, so whenever this, first you have to differentiate this. Now, if you have some ashy discoloration, or we have discoloration only in one part of the face, so the remedies change. Ashy, ash saman lagta hai, then you have to think about remedies like ferrum metallicum. Very important. Phosphorus, and one remedy which is very rare, but I have seen in my practice, the patient comes and tells you that since I have started swimming, my face has been tanned, is ash in color, and in those cases you have to think about remedy chlorine. Are you getting me? Chlorine. The remedy is chlorum, chlorum. Sometimes the discoloration of blackish, very very blackish and shiny black is there. Then you have to think about three remedies, very very important. First is China, second is lachesis, and third remedy that is very very important, I have used in repetition sometimes, that is Onintho crocata. Onintho crocata means Oenanthe crocata. Very very important remedy when the discoloration is blackish in color. Sometimes the bluish discolorations I have seen very less in my practice, so I cannot comment on that. But a lot of patients come with a discoloration which is of reddish hue, reddish type. Of course, belladonna is the first remedy. Second, you must think about Veratrum viridi. And third, you must think about Apis mellifica. So this is how you differentiate first and then go further. Welcome Dr. Pooja Khanna, Dr. Nigam. Lady of about 40 years with calcaneus spur pain during motion, need to hit calcarea cup followed by calcarea 6-6. I think we had an interesting, that was a case by doctor, I think, where he used calcarea cap 0 by LM potency for, I think, ligament. So calcaneum spur, again a very very interesting disease, I would say. And whenever the patient puts his feet after rest first time on the floor, the pain starts. Few remedies I would say are very very important, and I have got most of the results by these remedies. First is ledampal, second is ruta, third is Arenia didana, and the fourth is squilla. Okay, calcarea for 6x I have not prescribed for calcareum spur, so I will not be able to comment on that. Yeah, calcarea carb would be a good choice, but these four remedies I have got very very good results. In fact, Arenia didana and squilla, when I prescribe on 1M potency, it gives me very good results. Okay, so these basically are what the remedies which I use for practice. You also use this one of the four remedies. You can use in repetition if you have LM potency, or you can repeat this weekly once or once in 3 days, which I do, and you will definitely get results in about 10 days time, though not cure, but gradually it will get cured. So I hope Dr. Navjot, Paris quadrifolia was good. Okay, there are a lot of symptoms in a mater medica, but I was just thinking about that patient and answering your query. I think that case of high TG level was a very interesting case, and it really worked very well. Someone was feeling better with your, yeah, Dr. Navjot. That was a very interesting case, and yeah, Dr. Navjot, and it was a very interesting case, and sometimes dealing cases without seeing the patient becomes difficult because the intensity of answering the case becomes difficult. But yeah, everybody, her mother had gone through a very traumatic phase, and she got very well with the homeopathy medicines, and I'm very happy that she's sharing that case very well. Yeah, discuss on the WhatsApp. Okay, fine. Thank you, Dr. Navjot. She was causeless. Dr. Ju, she has causes in free of cancer, or if chest pain, develop fear of hypertension, if headache, fear of brain tumor because of patient, great care of sister-in-law. See, so whenever you have these type of cases, Dr. Joshi, one word is very very important in your case, and that is fear. So we have a personality, we has basically who has fear, and the fear is always constant. Okay, and how does a fear start? That is important. See, whenever you have fear, because basically either you have had a history, and that always comes to your mind that what will happen if my parents have a history of cancer. Secondly, fear, basically I have seen the personalities who are very very timid, they become very fear and anxious very fast. Okay, and third, fear as such, because he has been planned, he had expected lot things in life, but now he cannot do that. That's why he develops fear. So we have lot of rubrics. Don't take fear of cancer and fear of XYZ, because I have seen if you take disease fear, no, it does not get cured. So take fear in general, go to Sora, what was Sora, and automatically you will get to the remedy. Whenever there's a constant fear of everything, there are 3-4 remedies that comes to my mind which I have used in my practice. First is Pulsatilla, second is Kalikar, third is ignitia, and I think fourth is natrum carb, which I have seen. These remedies have constant fear, constant fear. Of course, there are a lot of permutation combination for fear, but this is a constant fear. So if you go with this approach, and you will be able to get better results, rather than going fear of cancer, fear of hypertension. The rubrics are there, but I have not got so result in the specific of disease. Cold abscess of long standing at ankle after muscle abscess discharge, size shriveled, yet some hypertrophy of muscle, skin remains, no symptom. How to follow? Yes, sometimes basically what happens, that part of leg is called as the pressure point. So whenever the patient walks, the area is healed, but because of that space, when you basically are basically walking on that, the space is filled by fatty tissues or connective tissues, and there is sometimes only swelling, symptomless swelling. So if there is no problem and the patient is better, basically wait for some time and give and see how does the body react, because in your case Moxol has worked, discharge is gone, shunt in signs. Wait for some time, maybe after some time you can repeat that remedy, or think of some other remedy which has a benign swelling of that part. Okay, just few questions just went above in I think Instagram, so you can always write. I just took long time for fear. Uh, yeah, so talking about fear, there are a lot of fears, no? Fear of death, fear of dark, and then what do you call fear of gastritis, and fear of disease, and fear of paralysis, and fear during when pain, perspiration, or during sleep. There are a lot of things of fear. So fear is a basic emotion of life. Everybody passes through a stage of fear, but comes out. If you cannot come out, then basically the problem starts. Milk aggravation, diarrhea, very offensive, flatters, excoriation, left corner of mouth, coryza, sneezing in morning, sneezing in morning, change of temperature, cold aggravation, warm food, and bathing desires. See, whenever you have basically milk, there will be lot of cases in your practice where the patient, when you basically start milk and you have lot of symptoms. Now if you only prescribe for milk and it is the diarrhea is there are few remedies. Those are very very important that everybody should know. Whenever that comes, milk causes diarrhea with cough, cold, sneezing. 3-4 remedies very very important. The first is magmure, the second is natrum carb, the third is sepia, fourth is calcarea carb, and fifth, you must always remember, it is sulfur. But then you must able to differentiate which type of milk. Mother's milk is there, boiled milk is there, hot milk amylase is there, sour milk is there, lot of other combinations. But these 4-5 remedies very very important, which I have used. Of course, there are some other remedies also, like we have Kaliahars, we have arsenic, we have natrum also. But calcarea carb, natrum carb, magmure, mag carb, sepia, and sulfur, very very important remedies in your case, Dr. Madan. Can you provide mobile number? Yeah, okay, from Assam, fine. I'll Dr. Utpal Paul, yes, I will. Dr. Gaurav, welcome. So I hope you got this about milk and cases of IBS and ulcerative colitis. Whenever you talk about milk, they'll start shouting now, no, milk is this, milk is that. And whenever I have prescribed on particular symptom that milk causes diarrhea, milk increases IBS, milk causes bleeding from the rectum, it has only temporarily ameliorated. So don't be so specific unless it is out of control. Otherwise, if certain things of food, basically the body does not agree, take the whole case rather than prescribing on particular. That is my experience in my practice. So yeah, good afternoon, Dr. Sadhna, and oh, you have joined in so late. Prophylaxis for flu, I'll not be able to answer. Basically, you can use whatever the Ayush government has told something about arsenic album. You can try that. Basically, I've never given that. I only believe in constitutional prescribing. And influenza is there, streptococcus is there, streptococcus is there, potency, and arsenic is there. You can always try those, but I have always used constitutional medicine in these cases. Dr. Sadhana Sahu, good afternoon. We are just in the completion of the session. So, any other thing? Any other question, Dr. Madan? I hope you understand. You got some remedies so that you can try in your patients and you can get back to us whether it has worked or not. And so, talking about anything else, I think in Instagram there were a few questions which I could not answer. If you can have, I'll be able to answer. Yes, so I think all questions answered and no questions left, I think. So thank you everybody. Thank you for joining and thank you for your time. Until tell something about today's scenario. Dr. Navjot, I'll talk later. I have a webinar at 4 o'clock. So maybe next time, and meet you again on next Saturday for a next and a good YouTube session live. Thank you so much for joining, and do share results if you have got results with the medicines I have told you. So thank you everybody. Thank you so much.